Good morning. Let's talk about how to keep your teeth healthy, functional, comfortable, and attractive for a lifetime. These are some home care tips. The main thing is this process that you do in the evening before you go to bed. Rinse your mouth with a good mouthwash. Crest whitening is a good one because it's got peroxide and not alcohol. Rinse for a minute, then floss your teeth, then brush with a Sonicare toothbrush. A mechanical toothbrush like a Sonicare brushes your teeth many times more effectively than a handheld toothbrush. Just think about it. With a Sonicare, it's going bzz, 500, bzz, 1,000 brushes, 2,000. At handheld, you're going 1, 2, 3, 4, 5. So get a Sonicare or another mechanical toothbrush if you really want to brush your teeth effectively, and put the toothbrush half on the gum and half on the tooth, and then brush the occlusal surface, the biting surface of the teeth, and then stick your tongue out and brush your tongue side to side. So then after you've flossed and Sonicared, rinse with mouthwash again. Remember, you only need to brush your teeth once a day at night because it takes plaque 24 to 48 hours to build up on teeth. So when you brush them again in the morning, you're only doing that for breath purposes. There shouldn't be anything to brush off the teeth because you shouldn't eat after you go through this process at night. So in the morning, just rinse out with mouthwash. That's fine. And then you may want to do that again during lunch. But this is how you do it with the Sonicare, half on the tooth and half on the gum, so you get the gum part of the tooth, and then brush the occlusal surface. And then stick your tongue out and brush your tongue side to side because you get buildup on the tongue. Don't brush like this or you'll gag yourself. Brush side to side. Here's a Sonicare. Then floss your teeth correctly. Look at a YouTube video. There are a million of them on how to floss your teeth. And it's important that you do it correctly. It's a shoe shine motion. When you go through the teeth, you make a hard C on each side of the tooth. Don't jam the floss down into the gum tissue. Make the hard C here, then the hard C there. And remember, you wrap the floss around the central finger and then use the thumbs or the pointer fingers to move it between the teeth. Use the thumbs for the upper teeth and the pointer fingers for the lower teeth. Again, watch one of a million YouTube videos on how to floss your teeth. These are the things you need to know about sugar. Normally, the stickier the sweet, the worse it is for your teeth. Caramel, raisins, honey, pecan pie, and candy bars are worse than ice cream, cake, popsicles, and pumpkin pie. The reason for this is that sticky sweets are harder to remove from the teeth than less sticky sweets. The more frequently sweet is consumed, the worse it is for your teeth. It's better to drink several sweetened soft drinks in a 30-minute period than to sip on a single soft drink over a period of several hours. One of the worst things you could do is be sitting at a desk and just nurse on a soft drink all morning. Sweetened breath fresheners and candy dissolved in the mouth are also not good if used routinely. The amount of time the teeth are bathed in the sweet is an important factor in tooth decay. Cough drops can fall into this category as well if they're not sugar-free. If a non-sticky sweet is consumed and it's not possible to brush your teeth afterward, take a mouthful of water within 5 to 10 minutes after drinking or eating that sweet and rinse vigorously, then swallow the water. This technique is not effective in clearing sticky sweets. Try to make the consumption of sweets an occasion rather than a routine. Now, these are some of the really bad kinds of sweets. Anything that's caramely, including Power Bars and Cliff Bars, are not good because they stick in the grooves of the teeth and in between the teeth. Cliff Bars and Power Bars. These Health Warrior bars, they sound like they're so healthy. They're really not. They're like eating a Snicker or any caramel bar. These are also bad. Gumdrops, Tootsie Rolls, anything taffy, anything that's gooey, sticky, sticks in the grooves of the teeth here. And what happens when that sticky gets into the grooves of the teeth, the bacteria gets into the sticky part, and it secretes an acid and works its way through this little bit of enamel right here. And the objective of the bacteria is to get into the dentin of the tooth, the soft part under the enamel. Once it gets into the dentin, it won't eat any of the enamel anymore. You'll never have more than just a small black dot here. Unless this caves in, then you'll have a large space. This is what that looks like. This is very beginning decay, and this doesn't look so bad, does it? But once I remove the enamel from that part of the tooth, you can see that this decay in that groove is like this, and this was profound like this, and I ended up having to do a root canal and a crown on that tooth because this was decayed into the nerve of the tooth. The other thing that happens with sticky sweets is the sticky sweet sticks in between the teeth, so in the grooves of the occlusal surface of the tooth and in between the teeth. That's why it's so important to floss the teeth every night. That's the only way you can get this out. A water pick won't do it. It's not bad to use a water pick, but it's not going to remove this part because there's a tight contact here, and the water pick water won't get into that part. You've got to pop floss through that. And you can see when you have sticky sweet in the interproximal contact, you always get decay on both of the teeth, two cavities right here. And then the decay, as the bacteria secretes the acid, progresses through the enamel into the dentin, and then it tracks into the nerve of the tooth. And once it gets into the nerve of the tooth, that's when you get a root canal and a crown. This is what that interproximal decay looks like. This person was a sticky sweet eater, and it stuck between the teeth, and so you get decay on the interproximal surfaces of both teeth. These are different drugs with dry mouth side effects. Atropine, scopolamine, antidepressants, blood pressure medication, antihistamines, anti-reflux drugs, opioids, marijuana, cytotoxic drugs, and all. You can read the rest of these. And all of them have the effect of causing can cause xerostomia, which is dry mouth. If your mouth is dry, that means the saliva is not bathing the teeth, which helps cleanse plaque from the teeth, which is what causes tooth decay. So dry mouth is really bad as far as decay goes. Be sure if you have a cough, you don't want to suck on a sugar cough drop. Get the sugar-free kind. These trays are also effective if someone has dry mouth. Many elderly people have dry mouth because they're taking medications like blood pressure medication. These are called Perio-Protect trays, and you put these trays on the teeth, and they have either peroxide or fluoride in the trays, and that bathes the tooth and helps prevent decay caused by dry mouth. Coca-Cola and Mountain Dew are the worst soft drinks. They're like drinking battery acid with sugar in it. Other soft drinks are not good, but these are the two worst because you've seen someone decorrode a car battery. They don't ask for a soft drink, they ask for a Coca-Cola. They taste fantastic, but they're really, really bad for your teeth. Again, like drinking battery acid with sugar in it. And when somebody is a big soft drink drinker or mint sucker, we can tell what kind of sweets they eat by where the decay is. Soft drink drinkers and mint or cough drop suckers get decay at the gum line on the side of the teeth. If you're a sticky sweet eater, you get decay on the occlusal surface, the biting surface of the teeth, or in between the teeth in the interproximal area. These are things that stain teeth. Certain types of green tea, red wine, coffee, especially strong coffee or espresso. So if you're a wine drinker and you don't really care if it's red or white, drink white because it doesn't stain the teeth. And drinking coffee or espresso with milk in it is going to dilute the staining effect. You know, it really stains the teeth, especially if you've got plaque on the teeth. Around the cemento enamel junction, if you've got restorations on the teeth like composites, they'll stain. So red wine and strong coffee are the worst. And then certain types of green tea. You can eat white ice, but don't eat clear ice. Clear ice doesn't have any air in it. The white ice is full of air, so it'll break, especially like Dairy Queen ice or Bush's chicken ice, that white, small, crunchy ice. It's full of air, and so it will break. Clear ice is like biting a rock. So if you want to crack a tooth, bite on clear ice, and you'll fracture your teeth. So don't do that. White ice, the smaller the better, is okay. Clear ice, not good. Then, almost everyone should either have a night guard or a dental snoring device, snoring sleep apnea device. What that does is it covers the teeth, so when you grind your teeth, you're grinding on the device and not tooth to tooth. This is what happens at night to most people when they're grinding your teeth. You rub these teeth together and it's like sharpening a knife. You get an edge on the tongue side of the lower teeth and the outer side of the upper teeth. And then when you have that little wire edge right there, you bite something and it fractures, and slowly your teeth get shorter and shorter. So be sure you wear a night guard or a dental sleep apnea snoring device. Our daughters got a night guard when they were 16, when they quit growing. Boys are a little later, probably when they're 20, but don't wait until the damage occurs. Get the night guard early on, or if you snore and have sleep apnea, you can use the dental snoring sleep apnea device, which is fantastic. I wear one of those, and they're terrific. Okay, so that's how to keep your teeth healthy, functional, comfortable, and aesthetic for a lifetime. And that's the Dental Minute. These techniques work, and they work every time.